In the name of Allah, the most merciful and the most compassionate, and Prophet Muhammad, peace be upon him. Audiovisual medicine tutorials in minutes. My tutorial today is about speech audiometry. Let's move on. First of all, some definitions. Speech detection threshold or speech awareness threshold is the lowest intensity level at which the listener can identify the presence of a speech signal 50% of trial without understanding. Speech recognition threshold or speech reception threshold, the lowest intensity level at which the listener can repeat 50% of the speech material presented. The word discrimination score, it is a supra-threshold subjective procedure to test the ability to understand speech. The SRT or speech reception threshold procedure, calibration check, earphone placement, and ear selection as in pure tone audiometry. Instructions to the listener should be short and uncomplicated. The listener is going to hear words through the earphone and respond. The speech materials used in SRT are bisyllabic words, familiar, phonetically balanced, and equal stress on each syllable. Masking to eliminate the influence of the non-touch ear using speech noise. Speech discrimination score, test procedure, calibration check, earphone placement, and ear selection as in pure tone audiometry. The speech materials used are monosyllabic words or digits used in children or conversation. The WIBI test, which is a word intelligibility by picture identification test used in children within 4 to 5 years, it is a closed-shot response by verbal or psychomotor by pointing. The result of the speech audiometry in conductive hearing loss gives excellent speech discrimination score. In sensorineural hearing loss, if it is mild, give excellent score. If it is profound, give poor score. In low frequency, give good score. And in higher frequency loss, give poor score. In sensory auditory perception disorder, the discrimination is not proportional to the pure tone average, which is poorer than expected. The clinical application of the speech audiometry came for confirmation of the pure tone test. The SRT should be within the 5 decibel of the mid-3 frequencies. In retrocochlear lesion, poor speech gives poor speech discrimination. It's used in pseudo-hypoacusis or in malingual hearing loss, and finally used in hearing aid fitting, hearing aid selection, and in cochlear implantation. Thank you for watching, and see you later inshallah in the next video. Peace and Allah's mercy be upon you.